Hello everyone. In this video we are going to talk about types of stretching, indication and contraindication of stretching, principles of stretching and common errors in the stretching. Static stretching. Stretching in which soft tissues are elongated to the point of tissue resistance and held in lengthened position for prolonged period of time with a sustained stretch force. It is commonly used method of stretching. It is an effective form of stretching to increase flexibility and considered safer than ballistic stretching. Static progressive stretching. It is another term that describes how static stretching is applied for maximum effectiveness. The shortened tissues are held in comfortably relaxation felt by therapist. Then the shortened tissues are progressively lengthened even further and again held in the new range. Cyclic or intermittent stretching. Keep repeating or keep rolling. A relatively short duration stretch force that is rapidly but gradually applied, released and then reapplied is described as cyclic stretching. It is applied for many repetitions during a treatment session. The end range stretch force is applied at a slow velocity in controlled manner and low intensity. Note: number of stretching increase and velocity and duration are decreased. Each cycle of stretch is held for 5 to 10 seconds. Ballistic stretching. Velocity is high. It is opposite of cyclic stretching. Definition: a rapid, forceful, intermittent stretch that is a high speed and high intensity is called as ballistic stretching. It is characterized by quick bouncing movement that create momentum to carry the body segment through the range of motion to stretch the shortened structure. It can cause greater trauma when stretch the tissue. It is useful in young population to increase range of motion safely. Contraindication: in elderly population you cannot give ballistic stretching. Sedentary individual, patients with musculoskeletal pathology, chronic contracture. PNF stretching. It produces neurological facilitation, normally applied in neurological rehabilitation. It is also called as facilitation stretching. It is integrated active muscle contraction into stretching, produced to facilitate or inhibit muscle activation. When muscle fibers are reflexively inhibited through reciprocal inhibition, there is less resistance to elongation by the contraction of the muscle. However, inhibition techniques are designed to relax only contractile structure of muscle, not the connective tissue and shorten muscle. Types of PNF stretching. First one is hold relax. The muscle that is limiting the range is first lengthened to the extent that is comfortable for patient. Procedure: patient is then perform a pre-stretch end range isometric contraction followed by voluntary relaxation of the tight muscle. The limb is then passively moved into the new range as the limiting muscle is elongated. Second one is agonist contraction. Agonist refers to the muscle opposite to the range limiting muscle. For example, if the hip flexors are tight, the patient can perform end range prone leg lifts by contracting the hip extensor concentrically. The end range contraction is held for the number of seconds. It is known as dynamic range of motion stretching. Procedure: patient concentrically contract the muscle opposite the range limiting muscle and hold the end range position for 30 seconds. The movement of the limb is controlled by the patient and it is slow, not ballistic. Third one is hold relax with agonist contraction. It is combination of hold relax and agonist contraction procedure. It is also known as reversal hold relax technique. Procedure: move the limb to the point of tissue resistance. Perform a resisted pre-stretching isometric to the tight. Manual stretching. Here the therapist applied an external force to move the body segment slightly beyond the point of tissue resistance and available range of motion. Therapist manually control the site of stabilization, direction, speed, intensity and duration of stretch. It can be performed with assistance or independently by the patient. It is controlled end range static progressive stretch applied at patient's tolerance and held for 15 to 60 seconds. Point to be considered: most appropriate at early stage of stretching program. Perform passively is a choice of a therapist or if patient can perform the self-stretching. If the patient has control of body segment to be stretched, it is helpful to the therapist to be stretched. Mechanical stretching. It is form of stretching which is performed by using a mechanical equipments. For example, cuff weight, weight pulley, system adjustable. Mechanical stretching device Apply a very low intensity stretch force for prolonged period of time to relatively permanent lengthening of the soft tissue. Duration of stretching ranges from 15 to 30 minutes to as long as 8 to 10 hours at a time. The duration is depend on the type of device and the severity of impairment and the patient tolerance. Long duration stretch required for a patient with chronic contracture as a result of neurological or musculoskeletal disorder with a mild hypomobility. Self-stretching. It is type of stretching which patient can perform independently after instruction and practice. It is able to increase or maintain range of motion. It is often used as a part of home program. Duration is 30 to 60 seconds holding. Necessary for long-term self-management of many musculoskeletal or neurological disorder. Teaching the procedure correctly and safely is important for preventing injury and dysfunction. Passive stretching. It is type of stretching which is performed passively either by therapist or by patient himself. For example, stretching for wrist flexors. Active stretching. It is form of stretching which is performed by active contraction of antagonist muscle stretching. For example, triceps contraction to stretch biceps. Principles of stretching. Alignment. Specific position of a limb or a body so that stretch force is directed to appropriate muscle. Stabilization. Fixation of one side of attachment while stretching of another side of the attachment. Intensity should be low, mild discomfort but not pain. Duration. Depending upon type, 20 to 30 seconds for static. Speed, slow and controlled. Repetition, depending upon goal, 2 to 4 repetition. Frequency, depending upon goal. Indication, hypomobility, muscle imbalance, to decrease spasm, to overcome contracture, to increase functional range of motion. Prevention, prevention of DOMS, delay onset of muscle soreness. Curative, muscle tightness, fascia tightness, adhesion or contracture. Contraindication, recent fracture, acute infection or inflammation, pain in stretch, tissue trauma or hematoma, hypermobility already exists. Precautions for stretching. Don't force a joint beyond range of motion. Remember, normal varies among individual. Protect newly united fracture. Extra precaution for known or suspected osteoporosis. For example, prolonged bed rest, age, and prolonged use of steroids. Avoid vigorous stretch of muscle and connective tissue that have been immobilized for a long time. Progress stretching dosage gradually to minimize tissue trauma and DOMS. Avoid stretching to edematous tissue as it is more susceptible to injury than normal tissue. Avoid overstretching of weak muscles, particularly anti-gravity muscle stretching. Common errors in stretching. Non-selective or poorly balanced stretching, stretching of already mobile or hypermobile muscle but neglect the tight muscle. For example, in sedentary population, hypomobility tends to develop in hip flexors, trunk flexors, shoulder extensors, internal rotation and scapular protraction. Insufficient warm-up. Individual involves in flexibility program and often fail to warm up prior to the stretching. Ineffective stabilization. Program often lack effective methods of self-stabilization. It transfers the force to mobile or hypermobile. Use of ballistic stretching. This form of stretching is not well controlled. It increases post-exercise soreness and injury to soft tissues. Excessive intensity. The phrase no pain no gain is used inappropriately as the guideline for intensity of stretching. Stretching program should be gradually progressed, should not cause pain or excessive tissue stretch. Abnormal biomechanics. Some stretching exercise don't protect the biomechanics of region.